Great, thank you so much. I'm very excited to be here today and to talk about our brand new hospital protection plan. It's so new that it's not even released yet. The release date is August 15th. That's the first day you could take sales. So we're super excited about this. Let's jump right in to the product. Hospital protection plan. Of course, hospital stay is so expensive. The average cost for one day in the hospital in the U.S. is over $3,000 and well over $4,000 in some cities. So it really just depends. But this is such an important product to help cover those high costs of hospitalization and then some other benefits as well. So before I get into the product details, I do want to just go through some definitions here. So calendar year, that means a 12-month period from January 1st through December 31st. Hospital confinement means inpatient in a hospital for at least 24 hours because of a covered injury or sickness. Period of confinement, that begins when the insured has been hospital confined and ends when there has been no additional hospital confinement for 60 consecutive days. And then observation stay. Observation stay starts at 6 hours of observation, and then after 24 hours, it's considered hospital confinement. So a brief overview, and then I'll get into the details here. The issue ages are 18 to 85. We didn't want to limit this to just the senior age. There are individuals out there that have individual health plans, either in the private sector or maybe through an ACA plan. So we wanted to make sure that this would be available for them as well to help them with this hospital cost that's enormous. It is guaranteed issue for ages 64 to 74. So the day before they turn 75, they're still eligible for coverage at age 74 and 364 days. It is automated underwriting and it's either issued or declined. There is a household discount that is available. It is guaranteed renewable. There's no ID card. No policy fee or application fee. There's no waiting period for the coverage to start. And there is a 6-month look-back period for pre-existing conditions. So the base benefit, there's 2 different options with this. They can choose a daily benefit amount or a lump sum benefit amount. So the daily benefit amount, they can choose anywhere from $100 to $1,000 in $10 increments, and then they choose the number of days that they want to cover. They can choose 3 days, 4 days, all the way up through 10, or 15 days, or 20 days, or 31 days. And then for the lump sum benefit, they can choose an amount from $100 up to $3,000. So as you can see, depending on what other coverage these individuals might have, maybe a lump sum is better for them, or maybe the daily benefit is better for them. So we want to make sure that they have options to, what's going to fit the best for them. Now, also included in the base benefit is observation stay. So observation stay is paid at 100% of the daily benefit amount, the daily benefit amount selected for the lesser of 5 days or the base hospital option selected. Inpatient mental or nervous disorder, that's going to pay at $175 per day, up to 7 days per calendar year. And then pet boarding. So this is $75 per day, up to 14 days per calendar year. So it's not per pet, it's just a flat $75 for pet boarding. One other thing to note here is that it pays up to the 14 calendar days, but let's just say this individual has a base benefit of 5 days. So it's going to pay, say, $350 for 5 days. But let's just say this individual was actually in the hospital for 14 days. The pet boarding is still going to pay the $75 for those up to 14 days, even though, you know, the base hospital might not pay for those 14 days or all of those 14 days. So keep that in mind as well. Also, with the base benefit, we have value-added benefits that we include on our Medicare supplement. And some of them we also will be including on this hospital protection plan. So those value adds are iMed, which is a discount on eye exams and eyeglasses and contact lenses. Amplifon is discounts on hearing tests and other services. Garmin, that is discounts on smartwatches, fitness trackers, scales. AlloCare is a voice-activated fall detection alert system. And then ScriptSave RX is the savings on prescriptions and medication management tools. So those are all included. Again, no other cost to that. Now, with this policy, there are 9 optional riders that they can include if they want at a cost. So let's go through these in detail so you completely understand how you can customize this plan to meet your client's specific needs. So the guaranteed purchase option rider. So what this does, this allows your client to increase their daily benefit amount by 15% after the first policy anniversary. So they can elect to increase the daily benefit up to 5 separate times over the life of their policy or up to age 85, whichever comes first. Now, the additional base benefit premium is based on the original issue age of the client. So let's say they purchase this when they're 65. When they're 75, they want to increase their policy by 15%. Their new premium amount is going to be based on their original age at issue, which is 65 in this instance. There's no underwriting required for this additional amount. And then if they do cancel the rider, the daily benefit amount reverts back to the original benefit amount and the premium is reduced to the original premium amount. So in this example, let's just say they had a $500 original daily benefit amount. A year later, they wanted to exercise their right to purchase 15% more. That's going to bring their new daily benefit to $575, and their premium is going to increase for that amount as well. But again, based on the original issue age. And again, they have 5 times that they could do this through the life of the policy. Okay, lump sum cancer. So with this one, they can elect the lump sum benefit amount that they want, either $2,500, $5,000, $10,000, $15,000, $20,000, or $25,000. It also pays a second lump sum benefit of $600 for skin cancer, regardless of the benefit amount chosen for the lump sum internal cancer. The rider is underwritten with health questions, regardless if they're in the guaranteed issue period or not. This rider is underwritten, and there's 3 health questions, which I'll talk about in some upcoming slides. If they've already had cancer, been diagnosed with cancer, they're not eligible for this rider. There is a 30-day waiting period, and then the rider ends once both the lump sum benefits are paid out. So let's look at an example. So let's just say February 1st, this client was issued a $25,000 lump sum cancer policy. It was their first ever diagnosis of internal cancer, and barring any pre-existing conditions, on March 15th, they were diagnosed. The rider is going to go ahead and pay a lump sum benefit of $25,000. If in the future the client gets skin cancer, they still have the $600 that would be payable for skin cancer. And then once that is paid out, the rider terminates. Okay, prescription drug rider. So with this one, the client selects a calendar year maximum benefit amount of either $250 or $500. And then the rider is going to reimburse them $15 for generic prescriptions or $30 for brand name prescriptions. So the way this works, again, it's a reimbursement to whatever they select, the 250 or the 500. So let's just say they chose a $500 benefit amount, and throughout the year they submit claims for 32 generic prescriptions, and they're reimbursed $480. So that's 32 times 15, $480. In December, they submit a claim for a brand name prescription, and they are reimbursed $20, as that $20 is going to get them to the $500. That's the maximum that it's going to pay out. Now, keep in mind, this is a reimbursement. So basically, the policyholder just submits pharmacy receipts, and then we'll reimburse them directly. They can use pharmacy receipts or explanation of benefits from a Medicare Part D plan, just some type of documentation which shows the prescription. And keep in mind, it doesn't matter what they actually pay for their prescription. So for example, maybe they have a Medicare Advantage plan that has $0 on generics, or maybe $2 on generics. It doesn't matter, we're still going to reimburse them that $15 for that generic medication. Now, this is not a standalone Medicare Part D plan, so just be careful not to market it as a PDP replacement, because it is not a true PDP plan. It's just a reimbursement plan that's going to help them pay for their prescriptions. Skilled nursing facility. So this adds an additional measure of financial protection for the clients that need skilled nursing care. It does require a hospital stay of at least 2 days to qualify for this benefit. Care in a skilled nursing facility must begin within 30 days of the hospital discharge, and then the benefit period ends with 60 consecutive days of not being confined in a hospital or skilled nursing facility. And then it resets. So there could be multiple benefit periods within a year. The key here is that they just have to have 60 consecutive days between that confinement. With this, the client can choose $100 all the way up to $500, and they can choose what days they want to cover for the confinement. So they can choose days 1 through 20, days 21 to 100, or days 1 to 100. So in this example, they chose a daily benefit of $250. If they choose days 1 through 20, there's no elimination period, it's going to pay day 1. If they choose days 21 to 100, that first 20 days, they're going to have to pay for that out of their pocket, and then day 21, the rider's going to kick in. And then, of course, days 1 through 100, there's going to be no elimination period. It's going to pay up to that $100, 100 days. Home health care. So this means care received in a home or provided by a home care agency. It does require that 2 days of hospital stay or skilled nursing before it's going to pay, and the insured must have either a cognitive impairment or the inability to perform 2 of the 6 activities of daily living. And then home health care must begin within 30 days of hospital or skilled nursing facility discharge. With this, they can choose anywhere from $50 up to $250 in $10 increments. And then the insured collects benefits for up to 30 home health care visits per calendar year. So again, it doesn't reset, 30 per year. Ambulance and emergency or urgent care rider. With this one, they can select a benefit amount of anywhere between $100 and $500. And then each benefit, meaning ambulance is one benefit, emergency room is another benefit, and urgent care is another benefit. Each one of those is payable 4 times per calendar year. So there's not like a lifetime maximum on ambulance, emergency room, or urgent care. It resets each year. So they're going to get 4 ambulance, 4 emergency room, and 4 urgent care each year. So ambulance can include ground, which also includes water ambulance, and air ambulance. Urgent care is paid out at 50% of the chosen benefit, and then the air ambulance is paid out at 10 times the chosen benefit. As you would expect, there could be an instance where somebody calls for an ambulance and then they go to the ER. So both of those benefits can be payable on the same day. Okay, so this is just an example. It's pretty self-explanatory. If they use an ambulance, they only have 3 left. If they use an air ambulance, they have 2 left. So this is just illustrating that they have 4 ambulance, 4 emergency room, and 4 urgent care. Okay, outpatient surgery rider. So more and more surgeries are being done on an outpatient basis. So this is a great rider to consider. If you think about it, think about like a knee replacement, even a hip replacement. It can be done in an outpatient surgery facility. So with this rider, they can choose benefits from $250, $500, $750, or $1,000. There's no waiting period for the coverage to start. And then the benefits are paid for a maximum of 2 outpatient surgeries per calendar year. So it's just 2 per year. There's no reset of a benefit period with this. Only 1 payment per day. So even if they have more than 1 outpatient surgery per day, we're only going to pay for 1. And then all we need is documentation from the surgical center, and then we'll go ahead and reimburse them for that. The outpatient therapy rider, the client selects a daily benefit of $50 up to $250, and they choose either 15 days or 30 days per calendar year. There is a chiropractic benefit that's built into this rider of 5 days per calendar year. And the benefit is paid once per day, even if multiple therapy sessions occur in a single day. Now, these therapy sessions, they have to be in an outpatient setting. They can't be in a home setting. So in this example, they chose a $15 per calendar year at $200 per day. So let's just say in August, they had sessions 1 through 4. It's going to pay $200 each session. September, they had sessions 4 through 8. Again, it's going to pay $200 each session. October, sessions 9 through 12. Again, $200 per session. November, they do sessions 13, 14, and 15. So they hit their maximum. After session 16, they're going to have to start paying out of pocket. Major diagnostic testing rider. So they choose a range from $100 to $500. There's no waiting period for this. And then the benefits are paid for a maximum of 2 diagnostic tests per calendar year. And there's no benefit reset for this. It's just 2 per year. They can, though, have both tests on the same day, and both would pay. Again, all we need is documentation from the hospital on this. And then diagnostic testing, pretty much what you would expect: the CT scan, MRI, PET scan, angiogram, computer tomography, angiogram scan, EEG, and EKG. Okay, so let's go ahead and talk about underwriting in the application process. So as I mentioned, a simplified issue. So outside of that guaranteed issue period, which you recall is ages 64 to 74 is that guaranteed issue period, the applicants, they just need to answer 2 health questions. So within the past 5 years, have you been advised by a medical professional to have any medical tests, treatments, therapies, or surgery that have not yet been performed? And that does include appointments that have been scheduled. And then question 2, do you have any pending test results? And this includes test results from routine procedures such as mammograms, Pap tests, colonoscopies, or PSA tests. Okay, so pretty simple. As I mentioned, the lump sum cancer rider does have its own underwriting, regardless if they're in the guaranteed issue period or not. So these are the 3 questions for the cancer rider. So within the past 5 years, have you been tested to determine if cancer is present? If yes, are the results still pending, or have the results indicated you need required further treatment or evaluation? And then number 2, have you been diagnosed with, treated for, or currently seeking treatment for cancer? And it lists the cancers there. And then have you been recommended to receive a colonoscopy, mammogram, or lung CT scan or other tests as part of routine screening for cancer, but not completed this screening? So pretty straightforward, but just wanted to make sure that it's clear that these questions on the cancer rider need to be answered regardless of their age. Okay, household discount. We do have a 7% household discount. To qualify for this discount, both people in the household have to have a Mutual of Omaha hospital protection plan or be applying for a hospital protection plan. And then when we're looking at what we consider a household member, it's just anyone that continuously resides with them for at least 12 months, or it resides with a spouse or a civil union partner. Okay, and again, the key here is both individuals have to have a policy or being applied for a policy. And then when you look at the premiums, they are unisex rates, issue age, and it doesn't vary by tobacco status. Each state has its own set of rates. There's no policy fee. The initial premium can be an automated bank withdrawal or a credit card, and then renewal premiums can be an automatic bank withdrawal, or it could be a direct bill, quarterly, semi-annually, or annually. To quote this, you can use our e-app. This is located on our Sales Professional Access under the Sales Tools section. It's right the same place that our MedSup and dental application is located, so it's all in one spot. So you can use that to quote hospital protection. And you can quote all 3 actually at the same time if you want to do that. So let's just say somebody is applying for a high deductible G plan, a lump sum cancer, and our dental coverage. Go ahead and quote all of them. You can apply for all 3 on the same location. Information transfers from one application to the other where applicable, name, address, some of that information. So there's less data entry. And then also with our brand new e-app that's been out there for about 1.5 years, 1 signature is required for all 3 applications. So it's very seamless and very easy for your clients to sign the application. They can sign the application via an email, via an IVR, so a voice recording. They can use text to sign, which that has quickly became one of the #1 ways that clients are signing their application. Basically, they just receive a text message with a code. They provide that code to the agent. They enter it into the application, and that's their signature. So very, very simple. Now let's look at just some sample rates so you get a good feel for how our rate structure is. So let's just say we have a client that has a daily benefit amount of $350 and they want 7 days in the hospital. So the base with this base premium with the household discount is going to be $29.81. And let's just say they're going to add a guaranteed purchase option rider for 7 days. That is going to be $2.92. And then let's just say they add the ambulance and urgent care at a $200 benefit amount. That's going to be $3.86. So as you can see here, with this premium, it's going to be right about $37, a little bit under $37 for very, very good coverage for this individual. Okay, again, how to submit an application. Out of the gate, we're not going to have a paper application, so you have to use the electronic application to submit policies. Again, this is a screenshot of our Sales Professional Access. Right there on the home screen on the left-hand side is the sales tools, and then right under that is the electronic applications. Okay, Now, how to submit a claim. We try to make it as easy as possible with multiple ways to submit a claim. But basically, the information that we're going to need is we need the UB04 hospital billing form that has all the codes on it that we need. Or if the client doesn't have that, if they have admission and discharge summaries that show the dates of service and the reason for the stay, that can be used in place of the UB04 form. And then the client just needs to provide us with their policy number, their name, date of birth, address, phone number, and their current email address. So that's the information that we need. They can call us, they can email us the information, they can mail us the information, they can fax us the information, whatever is most convenient for them, we can go ahead and take that information from them. Now, when we're talking sales and marketing, now I mentioned our product release is August 15th. The initial states we're going to be released in is the dark blue states there. So mostly the states in the southeast part of the country, except for like Michigan, Wisconsin, Arizona. So those are the states that have been approved already and that we are ready to release in on August 15th. The other states that are in the lighter blue, we have filed the product in those states. We do have some approvals. Those additional approvals are Ohio, Wyoming, Hawaii, Maine, Nebraska, South Dakota, Connecticut, and Nevada. So those states and any other ones that are approved here pretty soon will be in the next wave of release. And that is set, you know, we definitely will have the second wave of state releases before AEP. Again, we want to make sure we get as many states out there as possible. So right now we have a total of 17 states that we're releasing in, and there's a total of 25 states that are approved. We don't plan on filing in New Mexico, Minnesota, or Massachusetts, so keep that in mind. So as you can imagine, these plans can be tailored to fit the gaps with whatever the client has. So for example, maybe they have a Medicare Advantage plan with a monthly premium of $0. Inpatient hospital coverage, there's a $325 per day copay for days 1 through 6. Emergency care is $125 copay per visit, and then ground ambulance, $320 copay. So if you can imagine, with our hospital protection plan, we would recommend a $350 per day for 7 days. That's going to be $29.81. Recommend that they add the ambulance, urgent care, and emergency room benefit at $200 per day, because what that's going to do is that's going to pay for that $125 copay for the emergency room, and it's going to pay $200 towards the ground ambulance. That rider's $3.86. So for under $34, they're going to help pay for the gaps in their coverage with their Medicare Advantage plan. Now, if you're looking at a Medicare Supplement high deductible G plan, you know, the lump sum is going to be a great benefit for them. Because as you know, with the high deductible G plan, the client has to pay a deductible of $2,870 before the plan kicks in. So keep that in mind that, you know, if they go into the hospital, that's going to be a large sum of money that they're going to have to come up with out of their pocket. But if they have a $3,000 lump sum plan from Mutual of Omaha, that's going to help cover, or that will cover that deductible. So their plan G can start covering as a normal plan G would. So look at that. Also, maybe recommend a lump sum cancer rider and then maybe a prescription drug rider as well. So definitely going to help fill in the gaps of a Medicare Advantage, an ACA plan, a high deductible G plan. So keep that in mind. There's great benefits to having a hospital protection plan. We do have a product flyer that is available. a product guide that is coming here in the next week or so. We also have flyers on each of the 9 riders, which describes in detail how the riders work and what benefit it's going to provide to that client. We also have consumer materials such as a point of sale brochure, a prospecting letter. We also thought it was important to make sure that the clients understood the claims process. So there's a flyer on that, which outlines the claims process, so it eases their mind about how they file a claim. We also have created social media posts. If you're not familiar with this, we've created actually a social media hub on our Sales Professional Access website. That's our broker portal. So you can go to the social media hub and copy and paste pre-approved posts that you can use on your social media site. So not only do we have these hospital protection ones, we have dental posts, Medicare supplement posts, and just general Mutual of Omaha posts, including some even on Wild Kingdom. The nice thing about this social media hub, it does have a section which gives you some tips and tricks of, what site to post to, how often to post, how to sound more conversational versus salesy. So these are a great tool for you to use to brand yourself, basically, because you want to make sure that your audience knows that you offer these products. So when they think about an indemnity plan or a dental plan or a med sup plan, that they think of your name first. So that's what these social media posts are intended to do. It's not to sell over social media. Now, we do have a mutual sales leaders trip. This is a trip that we do every year. This year, the qualification period is always January 1st to the very end of the year. So the qualification period for 2025 is a trip to Rome in 2026. And we thought it was very important to make sure that hospital indemnity counted towards this trip. Even though we're not releasing it to the very end of the year, we want to make sure that that production can help you earn a trip to Rome. So what it is one production credit is equal to $1 of annualized new business premium. And you would need 250,000 production credits to qualify. Now, keep in mind, it's attainable. You can definitely earn a trip. Annually, we have anywhere between 80 and 90 agents who consistently go on these trips. They're consistently writing Mutual of Omaha, and they consistently earn one of these spots on this trip. Now, we also wanted to make it easy for Pinnacle Financial and also you, the agent, as far as the contracting goes. If you have a Mutual of Omaha Medicare supplement contract with us currently, with Mutual of Omaha or any of our affiliates, we'll automatically add hospital indemnity to your contract, so you don't have to worry about signing any new paperwork. It's going to be at the same commission level as your med sup commission level. And that's great because you don't need to worry about getting contracted. You don't need to worry about any special licensing or any additional training. You're going to be ready to go day one. Now, if by chance you don't have a Mutual of Omaha Medicare supplement appointment, just go ahead and get contracted now with our Medicare supplement. And then in August, you're automatically going to get this product. So here's our sales support email address. They are great for answering any questions or getting you to the right area. And then there's their 800 number as well, 800-693-6083. So definitely, if you have any questions, reach out to them. They will definitely be able to help you. Okay, so that's all I had. So Evan, we'll just see if there's any questions in the chat.
Yeah, and real quick, again, thank you so much. That was awesome. I really wanted to draw everyone's attention to three big things that I feel. I mean, I think Mutual of Omaha does several things with this plan that others don't, but the three biggest things that I really liked, whereas first they do the GI ages of 64 to 74. That's a really big window. So that's going to be a lot more helpful if you're doing a lot of Medicare Advantage plans to get people in and not have too many issues with underwriting. Second part is if they do have underwriting, the fact that they only have two questions, that's awesome. I think that makes it a lot easier to get in, and a lot of the competitors are doing five, six, seven questions. So really, really good. And the final thing is for the cancer rider, they do that $25,000 max on that. I think that was the right amount, right, Sandy? Said 25,000.
That's correct.
Yeah, and a lot of others are doing maybe 5 to 10,000. So there's a lot more just, added value there. So a lot of really, really good things. And so yeah, I definitely agree. If you are not contracted with Mutual of Omaha yet, it is time to get contracted. So we did just have a question come through. What states are available to sell this product, especially are New Jersey and New York?
Okay, I'll go back here to the little map because again, it's a brand new product for us. We're just releasing it in August, and the initial release is going to be 17 states, and it's the states that are shown in blue. So we have filed in the state of New York, and we've also filed in the state of New Jersey. They just haven't approved the product yet. But as soon as they approve them, then we'll go ahead and release the product in those states.
Perfect. And then a follow-up was, are the riders available in New Jersey? But I guess it's not there, but would they be available when that time comes?
Yeah, we filed all the riders in all the states. The only time it would not be included is if the state had an exception that they did not approve a rider in. But yeah, we did file the riders in all states.
Right. And while we're waiting to see if anything else comes through, if you guys go to the chat, I did put my information, my email, and my contact number. So again, if you are looking to get contracted, we can get that process started for you. Definitely recommend getting it done sooner rather than later. So when this product drops, you're already ready to start selling. So um,
Right. Now, I do want to mention to you, like the guaranteed purchase option rider, that is something that we think is very unique. I don't know of any other carrier that has that type of rider. So think about it like this: Medicare Advantage plans, their copays for hospitalization, it could change each year. So this is a great little option to add so you can keep up, or your clients can keep up with any changes to that copay to make sure that the rider is covering those costs, or the policy is covering those costs as they increase.
all right, I'll give it another 30 seconds or so. If anybody else has any other questions, throw them in the message here. If not, then we'll close everything out. All right. So I am not seeing anything else. Again, if you do have questions, you have anything, don't hesitate to reach out to me. If I don't know the answer, of course, I'll be calling Sandy and then she'll be letting me know. But I appreciate I appreciate everybody taking the time out of your day to attend. Sandy, again, thank you so much. That was amazing. And I hope everybody else just has a great rest of your day.
Great. Thank you, Evan. Everyone have
Of
a great
course.
day.